away immediately. You know, as soon as I went into the gastro and saw him, he's like, man, you look terrible. And then I came out of the colonoscopy, I was in a wheelchair, just barely awake. And he said, Robert, you've got Crohn's disease, and it's very severe. I would think you probably have less than 5 years to live. And he woke me up about 2 hours later and said, do you remember what we talked about in the hallway? And I said, Crohn's? And he said, yeah, and I'd never heard of it. I said, yeah, I don't know what that is. And he said, well, it's a digestive disease, and you've got a severe case. You need to probably get your affairs in order.
I couldn't fathom going through what he went through. The multiple treatments, the severity of possibly, not surviving, being told that he wasn't going to survive. Then hearing the impact on his life.
This is a perfect example of a chronic health condition that has contributed to an exacerbated mental health condition.
About 8 months ago, my fiance said, look, you've got to do something. Your health is sliding, your attitude and your depression is terrible, and you've got to do something. So then I went ahead and made another appointment, kind of reluctantly, went in and saw Michael, gave him, the background of everything that I've been dealing with, and, he said too that I needed to get a therapist involved, and so Lisa got involved then.
A patient comes in to Peak Vista and they're seeing the doctor, and the medical provider thinks that they would benefit in talking with somebody. At that present time, I will go in and talk with the patient. So Mr. Love said, yes, I guess I'll talk with her. And when I went in, he was very apprehensive. Now, I talked with a therapist before, it wasn't helpful.
Therapy to me was kind of raising the white flag. There's kind of a surrender deal. But I realized that my depression was taking me over, and that it was making my days very dark and gloomy. So I said, okay, I'll do it.
He would come and see me very frequently at first. I think that it was every week. And then as he started feeling better, as the clouds started to lift, then he started coming to see me about every 2 weeks.
When we are not only able to manage the symptoms of the medical disease, but also the mental health component that goes along with that medical condition, it opens that world up for the patient again.
The anxiety is a lot less. Because overall, he's living life.
If you'd asked me a year ago if I would be here today, I would have said, no way, I will never let a therapist be in my life again. With Lisa and with Trish now too, they've got a really good idea of what I'm going through and how to deal with it. And by golly, they're right. They both said, trust me, I did, and now I do completely, because they've really led me down good paths.
That patient was a great collaboration between primary care and psychiatry and behavioral health. Integrated care is bringing all the care to the patient in one environment. So we're reducing those barriers because all of those players are talking together. I think what I would want our community partners to know is that when you contribute financially to an institution like Peak Vista, it allows us to meet the patients where they are, be able to hire more staff, more providers to service more patients. We have a huge unmet need in this community right now for mental health particularly, and another contribution allows us to get one more patient the mental health care they need.
I think that my quality of life the past 6 months has been better than it has been in the past 25 years. And I credit that to Michael and Lisa and Trish. Those three have formed a team to kind of take care of Team Robert and making sure that that I'm okay, you know, and I absolutely pat them on the back for getting me here.